Bismillahirrahmanirrahim. Assalamu alaikum. Quote of the day is every act of kindness is charity. This is a hadith from Al Bukhari. My name is Dr. Aamna Khalid. I am a postgraduate resident of community medicine from Institute of Public Health, and I'm presenting the topic of endocrine disorders with a special focus on iodine deficiency under the kind supervision of my supervisor, Professor Dr. Saira Afzal. The learning objectives of today's presentation are: we will see the overview of endocrine disorders, iodine uses in human body, iodine deficiency disorders spectrum, the diagnosis, management, and prevention of iodine deficiency, global health issue, national burden, recent advances, and then we will do the practice of MCQs. So I'm presenting a case scenario. A 38 years old woman, originally from Lebanon, who had thyroid goiter, was referred by her primary care physician for evaluation. The patient recalled having a goiter for at least 1.5 years and underwent biopsy of a left thyroid nodule, which was negative for malignancy. Her dietary history indicated avoidance of iodized salt and seafood by choice. Her sister also had a thyroid disorder of an unknown type. Diffuse goiter was palpable on examination, and the lab test showed normal thyroid function, and her 24-hour urine iodine level was 90 microgram. Ultrasonography of the thyroid showed a diffused goiter. So, seeing all this, a diagnosis of iodine deficiency was made. So, we will keep this scenario and move forward. This is the overview of endocrine system. You can see there are different endocrine glands and they are secreting their respective hormones. But we will not go into the detail of every gland. Today's focus is on the thyroid gland that releases T3, T4, and calcitonin. So this is just a brief overview of the endocrine disorders. That in case of pituitary gland, if either there will be excess of ADH leading to SIADH, or there will be deficiency of ADH leading to diabetes insipidus. Then in case of pancreas, we have two kind of disorders like DKA and HHNS. In case of adrenal gland, we have Addison's disease in case of deficiency of cortisol, and Cushing's disease in case of too much cortisol. In case of thyroid, today's topic, we will see hypothyroidism and hyperthyroidism. And in case of parathyroid gland, a deficiency of parathyroid hormone leads to hypoparathyroidism, and its excess leads to hyperparathyroidism. So moving to the main topic today, iodine in human body. Our human body contains 15 to 20 milligram of iodine, and of which 70 to 80% is present in the thyroid gland. Other than thyroid gland, iodine is also present in the mammary, in the prostate glands, also in the pancreas, gastric, and nervous systems. Iodine has a suppressive effect in benign breast disease and benign prostatic hyperplasia. It plays a significant role in the early growth and development of most organs, especially the brain of the fetus. And it's the iodine deficiency is the single greatest cause of preventable brain damage and mental retardation worldwide. This is just a brief overview that how iodine is used for making thyroid hormone from point of the view of physiology. So iodine is essential component of thyroid hormone, as we have seen before, to make T4 and T3. Then this thyroid hormone then regulates many important biochemical reactions that include protein synthesis, enzymatic activity, and are the critical determinants of metabolic activity. They are also required for proper skeletal and central nervous system development and in fetus and infants. So, what are the sources of iodine? Uh, in diet, we can have iodine in fish, in seafood, in dairy products like milk, yogurt, cheese, and eggs. And iodized salt which is readily available in many countries. This is the WHO recommendation of intake of iodine in the age group of 6 to 12 years old children. 120 microgram per day is the requirement. Then when we move forward to the adolescents and adults, they require 150 microgram per day. And in pregnancy and lactation, we require 250 microgram per day of iodine. So what leads to the iodine deficiency? What can be the causes of iodine deficiency? Soils from mountain ranges such as Himalayas, they are deficient in iodine. Areas with frequent flooding are deficient. Food grown in iodine-deficient regions, protein allergy, malnutrition, ingestion of goitrogens, contaminated drinking water, bulky high residue diets, they interfere with the absorption of iodine, use of alkaline fertilizers, intensive cropping, all of this can lead to iodine deficiency. This was a news published in 2024 that the people in WHO European region iodine deficiency due to changing diets. These are some of the risk factors that, if present, can further lead to iodine deficiency, like selenium deficiency, pregnancy, exposure to radiation, goitrogens. Um, it's more in the women, smokers, perchlorate, thiocyanate. So iodine deficiency disorders is actually a spectrum. In case of the inadequate dietary intake of iodine, it leads to insufficient production of thyroid hormones, which then affects many body parts, including muscle, heart, liver, kidney, developing brain. So inadequate hormone production adversely affects all these tissues, and there is a spectrum of disease that appears that's called iodine deficiency disorders, IDD. If it occurs in fetus, we can see the abortions, stillbirth, congenital anomalies, increased perinatal mortality, endemic cretinism, and deaf mutism. If it occurs in neonates, there can be goiter, hypothyroidism, endemic mental retardation. In case of children and adolescents, the spectrum includes goiter, hypothyroidism, hyperthyroidism, impaired mental function, retarded physical development. And in adults, the spectrum include goiter with its complications, hypothyroidism, impaired mental function. There can be spontaneous hyperthyroidism in the elderly and iodine-induced hyperthyroidism. So we will briefly see some of the terminologies we have gone through in the spectrum, like goiter. Iodine deficiency stimulates TSH secretion, which results in thyroid hypertrophy, and that leads to enlargement of the goiter due to dietary iodine deficiency. This is called endemic goiter. When does it occur? When iodine intake is consistently lower than 50 microgram per day. Large goiter can cause choking and difficulty in breathing. Severe and prolonged iodine deficiency can lead to deficient supply of thyroid hormone, that's hypothyroidism, and major symptoms of it includes poor ability to tolerate cold, extreme fatigue, muscle aches, constipation, slow heart rate, depression, weight gain, swelling and thickening of your skin like myxedema. Then we have endemic cretinism that includes severe and irreversible mental retardation, deaf mutism, short stature, that's called dwarfism, reduced muscle tone and coordination, unable to maintain posture and balance with characteristic walking style, the sparseness of hair and nails, voice will be deep and hoarse, thickened skin, enlarged tongue, protruded abdomen, and umbilical hernia. Then we move to myxedema crisis. This is rare but life-threatening state of extreme hypothyroidism. It may develop with an acute illness and can be the first presentation of hypothyroidism if you miss the symptoms of hypothyroidism as mentioned previously. The symptoms of myxedema crisis include low body temperature without shivering, confusion, slow heart rate, reduced breathing effort. So, insufficient iodine intake during pregnancy can lead to reduced IQ of children by 8 to 10 points and even up to 13.5 points in case of severe deficiency, which can markedly impact the children's learning ability and school performance. So, how can we make the diagnosis of this condition? The most important thing is median 24-hour iodine urine. Then we can see thyroid function test and 24-hour radioactive iodine uptake and biopsy to see hyperplasia. So as I said, that most important one is median 24-hour iodine urine. So we should interpret how to see the results. In pregnant females, if it's less than 150, it means it's insufficient. And if in lactating females and also the children less than 2 years of age, less than 100 figure is insufficient. So we manage hypothyroidism by giving thyroxine tablets, and if in case of goiter is large, we go for the thyroidectomy. But the mainstay is prevention, and we will discuss it under the different headings like primordial, primary, secondary, and tertiary levels of prevention. So in the primordial, the goal is to prevent risk factors. We promote iodized salt use, public awareness, and a supportive policies should be there. At the primary level of prevention, we have to prevent the deficiency. So we can use universal salt iodization, iodine supplements, and salt monitoring. At the secondary level of prevention, there should be early detection and control. So we can screen for goiter, test urinary iodine, supplement high-risk groups. At the tertiary level of prevention, the goal is to limit the complications that have already occurred, the deficiency that have already occurred. So we need to treat hypothyroidism and rehabilitate affected children. This was the initiative taken by WHO that's called Universal Salt Iodization and Sodium Intake Reduction USI program. So in this USI program, the major focus was on the monitoring and evaluating the IDD control programs, reinforcing the collaboration between sectors, international resource laboratory network, sustaining this IDD control program. So we move to the challenges in IDD control program in Pakistan. At the level of national policies and plans, we need to focus on the sustainability of the program that's lacking, lack of the government funds. Salt industry is a low priority among governments. No national legislation is in place for mandatory salt iodization. Provinces have no harmonized approach. At the level of management and monitoring, there is absence of designated nutrition officers at the district level. Quality of our dye salt produced by small-scale producers is less than satisfactory. Limited information is available on the use of iodized salt in processed foods. Lack of efforts to ensure the awareness of iodized salt and its benefits. Absence of a regular and systematic mechanism for tracking iodine in household salt and urine. So this is the global burden of the disease that approximately 2 billion people suffer of iodine deficiency, and among them, approximately 15 million present with clinical manifestations. So in this map, you can see that the green color indicates that they have the adequate level of iodine at the school in school age children, and pink color shows the insufficient levels. So worldwide, 89.1% households consume salt with iodine, and you can see that as we are in South Asia, so in South Asia, 89.7% coverage rate is there. And in Pakistan, you can see in the map 79.6% households are consuming salt with iodine. And if you see the breakdown into the provinces, you can see that Balochistan is at the lowest level. 32 is the low, and these are the combined districts, some of the districts of KP. But if we go to the province level, Balochistan is lagging far behind, and Gilgit-Baltistan and Islamabad capital territory is 91%. So this is the iodine nutrition status in school-age children and the women of reproductive age. And again, you can see that here um, Gilgit is at the 59. So this is the roadmap timeline of the past years where different events have been taken place. This The upper graph, you can see that in the blue line it shows the school age children. The purple one shows the women of reproductive age, and the orange line shows the pregnant woman, right? And the blue line here shows the household use of iodized salt. So in 1980, there was the launch of multiple salt iodization initiatives, and in the coming 10 years, there was the iodized oil supplementation until 1993, and then there was implementation of IDD control program that we focused before. In 2005, a revitalization of this program was done, and in 2013, phasing out of the free donation of potassium iodate and establishment of a revolving fund to manage the distribution of it on no profit, no loss basis. So this was a study done to see the effects of iodine supplementation in pregnancy on iodine status. Again, a study was done to see the effect of nutrition education on iodine deficiency disorders. This study done in Pakistan showed that rural-urban disparities were observed in the socio-economically disadvantaged districts, and these disparities limit the effectiveness of IDD prevention program in rural areas in Pakistan. So they concluded that implementation of mandatory salt iodization requires improvement, and program effectiveness should be continuously monitored. These are the organizations working for IDD control program, including WHO, UNICEF, World Food Program, Nutrition International, Iodine Global Network, International Council for Control of Iodine Deficiency Disorders. Iodine Deficiency Disorders Prevention Day is celebrated on October 21. So the key message of today's presentation is that iodine deficiency greatly affects children and pregnant women. So iodized salt is the mainstay of prevention, and awareness through health education is significant. So that was the presentation today, and we move on to the practice of MCQs. Question number 1 is, what is the most appropriate method for diagnosing iodine deficiency? Option A, serum iodine levels. Option B, urinary iodine concentration. C, thyroid hormone levels. D, goiter prevalence surveys. E, physical examination.
B.
Yes, B is the right answer. Question number 2, what is one of the main control measures for preventing iodine deficiency disorders? Option A, public health campaigns. Option B, increased consumption of dairy products. Option C, iodine supplementation. D, mandatory iodized salt use. E, using iodine in fertilizers.
D.
Yes, D is the right answer. Question number 3, what are some common sources of dietary iodine? Fruits and vegetables. B, red meat. C, fish and dairy products. D, whole grains. E, water.
E.
C, fish and dairy products are the common sources. Question number 4, what is the recommended daily intake of iodine for pregnant women? 300 microgram, 220 microgram, 250 microgram, 150 microgram, or 100 microgram?
C.
Yes, C, 250 microgram. Question number 5. A pregnant woman in the rural area of Pakistan presents with symptoms indicating potential iodine deficiency. She reports limited access to iodized salt and consumes mainly plant-based foods which are low in iodine. Recent studies show high goiter rates in her region despite ongoing supplementation programs. How does iodine deficiency during pregnancy affect our thyroid function? Option A, it impacts only the mother's health, not the fetus. Option B, it greatly increases thyroid hormone production. Option C, it does not significantly affect thyroid function. Option D, iodine deficiency can cause hypothyroidism and affect fetal development. Option E, it causes thyroid carcinoma.
D.
Delta.
Yes, D is the right option. Question number 6. A male baby born in the setting of public hospital through C-section. After 4 months, the mother presented with the complaint of yellow-colored skin along with a lethargic baby who is having delayed developmental milestones. Mother was deficient from iodine throughout the pregnancy. Iodine deficiency in a baby could result in option A, cretinism, option B, cryptorchidism, option C, chronic hyperthyroidism, option D, thyroiditis, or E is Graves' disease.
A.
Yes, A, cretinism. Question number 7. A school health team conducts goiter screening among children in an iodine deficient area and provides iodine supplements to those at risk. Which level of prevention is being implemented? Primordial, primary, secondary, tertiary, or quaternary?
C.
Yes, C is the right answer. Question number 8. Which of the following is not a risk factor of developing iodine deficiency? Selenium deficiency, pregnancy, goitrogens, OCPs, or fish intake?
D. Fish intake.
Yes, fish intake is actually a source of iodine. Question number 9. Women presented to emergency with cold extremities and confused state. Her BP was recorded as 100/70, pulse was 49, respiratory rate was 10. She also had a neck swelling on examination with a complaint of dry yellow colored skin of lower legs along with itching. What do you suspect this patient was suffering from? Addison's disease, myxedema crisis, circulatory shock, subdural hematoma, or respiratory failure?
B. Mixed edema crisis.
Yes, myxedema crisis. Question number 10. Which of the following is not a possible cause of iodine deficiency? Option A, intensive cropping, frequent floods, mountain ranges, fish and dairy products, or alkaline fertilizers.
D.
D is the right answer. So this is the MCQ's key. This is the YouTube channel of Institute of Public Health Lahore, where this presentation will be uploaded. Thank you.